Welcome to the hematology lecture. Okay, we're going to talk about the anatomy and physiology of the hematological system. So hematology is just the study of blood in the blood-forming tissues. And the tissues that we're concerned about is bone marrow, the blood, the spleen, and the lymphatic system. So the blood is formed in the bone marrow. That's the hemopoietic, means the hemoforming. Blood forms in the bone marrow. It's also in the lymphatic tissue. All cells originate from stem cells. So when you're looking at the bone marrow, you've got yellow bone marrow, which is fat, and then red bone marrow, and that's what produces the red blood cells. So the function, the different cells all originate from the stem cells. Erythroblasts become red blood cells. The immature ones are called reticulocytes. The mature red blood cells are called erythrocytes. Then the myeloblasts create the granulocytes, the granulocytes, the granular blood cells. Basophils, eosinophils, and neutrophils, those respond to different invaders. Basophil is allergy and inflammatory. Eosinophil would be as a result of parasites, and the neutrophils are the particular white blood cell that fights bacterial and viral infections. If you notice, the neutrophils are segmented. The immature cells are called bands because they're not segmented yet. And then you have the agranulocytes, monoblasts, lymphoblasts, and megakaryocytes. Megakaryocytes develop down into the thrombocytes. The other two are the monocytes and the lymphocytes. And all of these, from basophils to lymphocytes, constitute the white blood cell count. So the formation of blood production is called hematopoiesis, and that occurs in the bone marrow. The bone marrow produces red blood cells, white blood cells, and platelets. And the three types are from non-differentiated immature blood cells in the bone marrow called the stem cells. So the bone marrow is that soft material in the center of the bone. There's two different types, as I showed you from the previous slide. The yellow one is adipose or fat, and the red bone marrow is the hematopoietic bone marrow. It produces the blood cells. Bone marrow is typically found in an adult in flat and irregular bones, such as the ends of the long bones, the vertebra, sacrum, sternum, ribs, flat cranial bones, and scapula. It is classified as a connective tissue, and there's three things that blood does. It transports, it regulates, and it protects. Transportation is bringing the oxygen from the lungs to the cells. It also takes nutrient from the GI tract and brings it to the cells. It also helps transport hormones from the endocrine glands to the target organ cells, and it removes metabolic waste from the cells and lungs and take from the liver and kidneys. The regulation that it's involved in is the fluid and electrolyte balance, acid-base balance, body temperature. The protection that it does is it helps maintain homeostasis of blood coagulation with the platelets that are present, and it combats invasive pathogens with the white blood cells. So the different components that make up the blood includes plasma, the solutes, which are the minerals that are dissolved in electrolytes, erythrocytes, the red blood cells, leukocytes are the white blood cells, and then platelets are the thrombocytes. 50% of the blood is plasma, and that's primarily water, but it also has protein, electrolytes, the oxygen, CO2, nutrients, and waste products. The other 45% are the spic cells, red blood cells, white blood cells, and platelets. Primary function of the different cells, the erythrocytes transport the oxygen and assist in maintaining acid-base balance. The leukocytes, or white blood cells, protect from infection, and the platelets, or thrombocytes, help promote blood coagulation in response to an injury. These red blood cells are very flexible cell walls, so they can alter their shape to pass through the capillaries. They're biconcave, which means they're concave on both sides, and their thin wall helps facilitate gas moving across the membrane. The composition of the red blood cells is primarily hemoglobin, which is a complex protein iron compound, and that's what binds with oxygen to bring the oxygen to the tissue that is to perfuse it and removes the carbon dioxide. A normal red blood cell lifespan is 90 to 120 days. A leukocyte, when it's separated from the blood, it looks white. That's why it's called a leukocyte. Originally from the stem cell in the bone marrow. There's granulocytes, that's the basophil, eosinophil, and neutrophil, and then agranulocytes are the monocytes and lymphocytes. 5 different types of leukocytes, each one has a different function. So neutrophil is responsible for phagocytosis, and it appears early in the inflammatory phase. Eosinophil also does phagocytosis, but it's particularly increases in response to a parasitic infection. And then a basophil, again, inflammatory response, but is more for the allergy type response. The agranulocytes, the lymphocyte is the cellular humoral immune response, and then the monocyte is the big heavy hitter, phagocytosis in response to cellular immune effects. So the granulocytes, they're called a granulocyte because they have granules in the cytoplasm. The neutrophil is the most common form, so 70 to 50 to 70% of all the white blood cells are neutrophils. Eosinophils are very small amounts, only 2 to 4% of all the white blood cells are eosinophils, and basophils are even more rare. There's fewer than 2%. How you determine what all of these parts of the white blood cell count is if the doctor orders a complete blood count with differential. The differential is looking at how many neutrophils, how many eosinophils, and how many basophils. That will give them an idea of what type of invasive agent that they're dealing with. So the neutrophils are primarily involved in phagocytosis, and that is basically engulfing an invader, and it occurs when there's an acute inflammatory response. As I mentioned, the mature neutrophils are segs, and the immature ones are bands. So a way to determine if they're how long the patient has been fighting an infection is if the bone marrow starts producing an increased number of bands. In response to an infection, the white blood cell count increases. But if you look at the number between the segs and the bands, the more bands indicate that the infection's been going on for a while and they're trying to gin up more white blood cells, but they're not mature enough to be very efficient. So it's called a shift to the left. When they look at there's more bands than segs, it's called a shift to the left, and that means the infection is going on. One way to help remember segs versus bands is segs are sexy and bands are babies. This is 3 segs, this is segmented, and this is a band. It's not mature yet. Neutrophils are the first ones that go to the site of infection, and here's, as I mentioned, the shift to the left. Bone marrow is releasing less mature cells. The lifespan for a white blood cell, a neutrophil, is 2 to 14 days, so they don't last near as long as red blood cells. Eosinophils, 2 to 4% of the white blood cells. They're not as good at phagocytosis compared to the neutrophils. It is a granulated one, and the granules contain histamine. So they engulf the antibody-antigen complex formed when there's an allergic response. So they're the allergic ones, and parasites. And one way to remember eosinophils with parasites is eosinophils and euparasites. They're found in large number in the lungs and the GI tract, because typically if a person develops some kind of a parasitic disorder, the entry was either the lungs or through the GI tract. Basophils are less than 2%, and they're very limited on the phagocytosis side. They do have the granules that contain heparin, serotonin, and histamine. And when an antigen stimulates the basophil, it releases its granules. And so it releases the histamine. So that's why a patient, when we're having an allergic response, we want to give them an antihistamine. Agranulocytes Lymphocytes don't have the granules, and so they're also called mononuclear cells because they only have one discrete nucleus. Lymphocytes are 20 to 40% of all the leukocytes, and the monocytes are 4 to 8%. Lymphocytes are the basis of the cellular humoral immune response, and they have two subtypes. They're type B cells and T cells. And when a person has AIDS, they're always concerned about what is their T cell count. Another agranulocyte, the monocyte, potent phagocytic cells, very strong. It's the second type of cell to arrive at the site of injury. And when they migrate into the tissue, they become macrophage. And their macrophage is the cell that will engulf the debris or the invading agent. There are certain tissue that have their own monocytes, and they're named based on where they are. So the macrophages in the liver are called Kupffer cells. The bone, they're called osteoclasts. And in the lungs, they're called alveolar macrophage. So let's talk about platelets. The primary function of a platelet is to start that clotting process at the site of injury by producing a plug. They're going to put a cork in it. They're released into the circulation by cells in the bone marrow called megakaryocytes. Platelets have a very, very short lifespan, only 5 to 9 days. They also help participate in shrinking the clot and retraction when the clot starts to break up. Normal blood clotting mechanisms will minimize the blood loss after the injury. So basically 4 things happen when a blood vessel is injured. The vascular response is that the vessel will constrict. That leaves a smaller area for the platelets to create their plug. Once the plug is there, the fibrin is going to start being laid down by the clotting factors. The last thing that happens in a clot, the injury is healed. There's no longer releasing any blood from the injury, so that clot then is not needed anymore, and the body will naturally lyse that clot. So the vascular response is vasoconstriction, helps reduce everything, gives time for the platelets to respond. The platelet plug forms, and this is a depiction here. The interstitial collagen is activated. Platelets become stickier, and that's increased adhesiveness. So they form a plug and facilitates the reaction of the plasma clotting factors. Without the clotting factors, a blood clot cannot occur. It's like an ingredient to a cake. You can bake a cake and have all the ingredients in it except you forgot the sugar. It's going to come out looking really good, but you take a bite out of it and it's just not going to taste like anything you would want to eat. So without all of the ingredients, you don't have the cake. So without all of the clotting factors, you don't have the ability for a clot to form. And these clotting factors help form that fibrin. They're named, they have names, and they're identified usually by Roman numerals. They're always present until stimulated to initiate a clot through one of the 2 pathways, intrinsic and extrinsic. Intrinsic is activated by collagen exposure. Extrinsic is activated when the tissue factor or thromboplastin is released from the injury. Thrombin is the most powerful enzyme in the coagulation process because it converts fibrinogen to fiber, which is that absolute. This is what makes the clot. So when the clot is no longer needed, it will dissipate through normal fibrinolysis. Using an anticoagulation reverses the clot to keep the blood fluid. The antithrombins interfere with thrombin. So with fibrinolysis, the clot, it dissolves. And this is part of the fibrinolytic system. Plasminogen to plasma, fibrin, fibrinogen, and when the fibrin breaks down, it leads to fibrin degradation products. This is when a patient they're looking at the dimer. This is what it measures. It indicates that there is a clot somewhere. There are other organs that are involved in the hematological system besides the bone marrow. The spleen is important because it destroys or removes older imperfect red blood cells. It also stores platelets and filter out antigens. It's a reservoir for blood products that aren't necessarily needed, but they can be available as soon as when they are needed. If a patient has their spleen removed because of trauma or cancer or something like that, because the spleen also stores white blood cells, the removal of the spleen can affect the patient's immune response. The other organ that is involved in the hematological system is the liver, and that's where the prothrombin and blood clotting factors are formed. So it's very critical. The liver is critical for forming vitamin K in the intestinal tract, and the liver also stores iron as ferritin. The spleen is located in the upper left quadrant next to the kidneys, kind of around on the other side of the stomach. And the functions are hematopoietic. It's able to produce red blood cells during fetal development. The function of the spleen removes old and damaged cells, removes hemoglobin from the red blood cells, and returns the iron to the bone marrow. So it is like the first recycle center in the body. It filters out bacteria, especially encapsulated organisms, so that it helps with the immune system. It contains a large supply of lymphocytes, monocytes, and immune globulins in the spleen. The immune globulins are going to help boost the immune system. So that's a nice reservoir of infection-fighting materials. It also stores red blood cells in approximately 30% of the total mass of platelets. So in addition to having an extra store of white blood cells that are ready to shoot them out whenever the need is, it also stores red blood cells. So if they're needed to have extra oxygen carrying capability, it can secrete them. And almost a third of the platelets that a person has in their body are stored in the spleen. So you can see how if the spleen was removed, it's going to have an impact on the hematological system. The liver is a filter, and in the liver are the procoagulants that are necessary for hemostasis and blood coagulation. Excessive amounts of iron, rather than just, oh, I don't need it now and have it excreted in your stool. The liver say, you know what, I'm going to keep some aside for a rainy day. So let me just hang on to this extra iron. And oh, by the way, those red blood cells that are being destroyed, I'm going to take that iron too. And that is the hepcidin, which is the key regulator of the iron balance, is going to keep everything balanced. So the lymphatic system is another aspect of the hematological system. And these are little pathways throughout the body that contain lymphatic fluid, and there are little lymphatic ducts and capillaries and nodes that you can find in the body. A lot of them in the neck and in the axilla area, and then there's a lot of lymph nodes in the abdomen. So the things that are maybe taken out from the GI tract, we want to get them back into the circulatory system. We want to bring hormones around into the circulatory system, and that's the effect of the lymphatic system. So if there's excess interstitial fluid in the blood, they will return that to the lymphatic system, and that helps reduce edema or prevent edema. So the lymphatic system fluid that you see is pale yellow. That's diffused through capillary walls. It has its own special vasculature, so it's not going through the blood system, it's going through the lymphatic system. If they develop too much interstitial fluid or they're not able to absorb it, it can lead to what we call lymphedema. And this is what you see when a patient has had a mastectomy or a lumpectomy and they've taken lymph nodes out to assess for metastasis of the cancer. You'll see patients where their arm on that affected side, the side of the mastectomy, will get a significant amount of edema, and it's called lymphedema. The lymphatic capillaries are very thin-walled vessels with irregular diameter. They're bigger than a blood capillary, but without the valves. Your veins have valves in them to allow for the blood to go back to the heart and not backflow into the blood vessel. So these unite to form the lymphatic vessels that carry the lymph fluid. And it goes from the right lymphatic duct or the thoracic duct, and they drain into the subclavian veins in the neck. So basically, they have their own circulatory system, but they dump everything back into the blood system through the subclavian veins. Lymph nodes are tissue that are found in groups along the lymph vessels at various sites. There's more than 200 in the body. The largest concentration is in the abdomen surrounding the GI tract, and the primary function is to filter out pathogens and foreign particles carried by lymph fluid. The lymph fluid is like a moving garbage treadmill kind of thing that, you know, as it pulls it out and it pulls it out, and then it's like, okay, now we have to dump it. So they dump it into the blood. The blood is going to filter it through the liver and excrete it through the GI tract or the urinary tract. And there are superficial nodules, which you'll be able to feel if you have an infection. The nodes are going to increase in size, and you'll be able to palpate them. And you've got some that are deep nodes that you aren't able to palpate. So as a person gets older, there's some changes to the hematological system. For one, the bone marrow becomes less active, so that puts the patient at greater risk for anemia because of decreased red blood cell production. Other things happen as you get older. The patient develops postural hypotension. The patient becomes less tolerant to cold. They have more edema, inflammation. They can have, if the blood isn't flowing well, they can have those pressure ulcers or venous stasis ulcers, as I mentioned in a previous lecture on the medial malleus. And just the fact that as you're older and these blood vessels changes, it can affect medications. The other thing that can happen as a person gets older is the immune system is impacted. So the patient has a greater risk for infection and cancer. They don't respond the same way. And as a person gets older, if their immune system weakens, they can have a possible reactivation of tuberculosis. So looking at the blood studies, diagnostic studies, you're going to look at the complete blood count. That's going to tell you how many red blood cells, white blood cells, and platelets. If you want to know the division of the white cells, then it would be a CBC, a complete blood count with differential. And that's going to identify then how many neutrophils, basophils, eosinophils, etc. You're also, one of the things you can look at is your iron metabolism. How much iron, you got free iron and you've got stored iron. Look at your ferritin levels. Radiographic studies as well, and then there's biopsies. If you're concerned about the bone marrow production and you're looking to see if that is an issue, they can do a bone marrow biopsy and look at how much of the bone marrow is red bone marrow, which is the hematopoietic marrow, and how much is the yellow or adipose marrow. That concludes the lecture for the blood anatomy and physiology. If you have any questions, please email me or bring them up in discussion. Thank you very much.